Good afternoon, everyone, and welcome to today's session of Learn Lounge. Here at Springpod, we are dedicated to helping young people make more informed choices when it comes to their future careers. Now, throughout Learn Lounge, we are bringing influential speakers directly to you to share their career stories, from athletes, filmmakers, entrepreneurs, and everything in between. And we've had some absolutely incredible speakers so far, including football manager Mark Warburton from QPR, of which Dr. Ahmed also works for as well, motivational speaker Mr. Beasy, and BAFTA award-winning cinematographer Sophie Darlington, and many, many more. If you've missed any of those, then please do not worry. You can catch all the replays on demand, like I said, via the Learn Lounge website. That's learn.springpod.co.uk. My name is Joe, and I'll be hosting today's session of Learn Lounge. Just a couple of pointers before we start. That was back when I could actually have my hair cut. The talk should last about 40 minutes. Please do ask questions to our guests. They'd absolutely love to answer them. And remember to tag us on social media with the hashtag LearnLounge as well. And we're also in partnership with the Children's Trust, but I'll talk more to you about that at the end of today's session. Today, like I said, we're joined by the Head of Medical Services for the Queen's Park Rangers Football Club, Dr. Imtiaz Ahmad, with extensive experience working as a medical professional within the sporting industry. He is well versed in thinking on his feet and decision-making in potential crisis situations. Now, in this exclusive session on Learn Lounge, Dr. Ahmed takes us through his illustrious career journey, the art of communication in an elite performance environment, how to get into working in football, and of course, shed some light on how they've tackled the COVID-19 coronavirus crisis in football. It's an absolute honour having him here today. I'm very, very excited to chat with him, and I hope you are all too. And he's going to be sharing his specialist knowledge with us today. Dr. Ahmed, welcome to Learn Lounge. Thank you so much for being here.
Thank you very much, Joe. I'm actually delighted to be here, and looking forward to the session.
Brilliant. So let's start off right at the beginning. Just tell us
a bit about myself.
Yeah. Let's just start right there. Do you want to tell us a little bit how your career started and where it all began?
Okay, so I'm currently sitting in a Lambeth GP surgery, which is where I work part-time along with my work at Queen's Park Rangers. And I was born in Lambeth, raised and grew up in Tooting in South London, and went to local schools in Battersea and then in Wimbledon. And that's probably a lot of target age group for people who are watching this podcast at the moment. So at that stage, I wasn't quite sure where my career was going or what I wanted to do in terms of future careers, but I was mainly by my parents strongly encouraged to kind of look towards a medical profession as a career, and that's where I ended up applying for my levels, and I went to Guy's and St Thomas's medical school. Really enjoyed my 6 years over there, and after that, I had to make a decision about what I wanted to do going forwards after that. So at that stage, when you do medicine, whether you want to be a
it appears as though Dr. Ahmed might have dropped out on us there, unfortunately. It seems as though he's dropped out on us, but we're going to try and get him back as quickly as we can. In the meantime, though, make sure that you're following us on social media. And here he is, Dr. Ahmed. Can you hear me okay?
Yeah, I could hear you the whole way through. So,
could you? Oh, so it might have been on my end then. Yes. Yeah, I can hear you just fine. So yeah, carry on.
So I think I was just talking about my decision about whether I wanted to be a hospital doctor or a journalist, and I thought it'd be good to be a journalist. I'm very interested in people, very interested in communication, wanted to follow patients through. So that was where my main interest was. And then I decided to take a year out to do a master's in sports medicine. Now, my reason for that, I've always been really interested in sport all the time, ever since I can remember growing up. At school, I was in a lot of teams, playing rugby, football, cricket, even chess. I was strongly encouraged by what I could. So, even as a career, and at the time, it was quite an early specialty, so it was really developing. It was mainly a subspecialty, especially of enthusiasts, so GPs like myself, hospital doctors, orthopedic surgeons, just generally people who liked football or sports and wanted to work in that area. So we got together and did an MSc at the Queen Mary's University. And really enjoyed that. I did that with a good colleague of mine, and took it as a full year. And things really snowballed from there. I just really developed my interest from there and got quite a few opportunities.
So what sort of sports were you interested in from the start? Because I know that at the moment you're a consultant for the Pakistan Cricket Board as well. So I'm guessing football and cricket both sit in your interest somewhere.
Yes, they do. So cricket's always been a massive passion of mine, but mainly just as a spectator. And again, with my brother and my father, we just love watching cricket together and just debating it with our friends. So I only started working in cricket recently after I become more established as a sports medicine doctor. In terms of my own passion for playing sports, it was football with friends and rugby at school. So the school that I went to, Emmanuel School, and then King's College School. If you were in the rugby team, then you couldn't play football for them. So it was either one or the other. So I was in the rugby team, so played football just with friends. And so as soon as I started university, I really took up football more, playing at university on a more I was going to say serious level, but certainly not nothing like the level that I'm working at now. But just playing more formalised football.
And why? How? Okay, sports medicine is often sort of not seen to be the same as being a doctor itself. But why? What is the difference between working for a sports team to working in a hospital? What sort of differences are you facing there?
Yeah, that's a really good question. So I think the first thing about being a sports medicine doctor, I would say, you have to be a generalist. So you've got to be able to manage people in terms of their medical conditions, just like a GP would. So people can come with coughs and colds. They can come with all kind of sorts of medical type issues. So you've got to be really competent with those. Of course, a high proportion of what we see are injuries related to the sport that you're looking after. So there's lots of managing those injuries along with a team. So the next phase probably is that teamwork aspect. So working in a multidisciplinary team with physiotherapists, with sports therapists, sports scientists, psychologists, nutritionists, and that's just part of the medical team. And you then kind of work your way towards working with other coaches as well, and then the wider members of the team. So I would say being a generalist and then subspecializing in sports injuries is probably the best way to think about it.
Like we mentioned earlier, you joined QPR in 2016, so that was 4 years ago now. So you've been at the club for a while. What sort of injuries are you facing there, and what sort of care are you giving that would perhaps differ from, say, a different type of sport, cricket, for example?
Yeah, so working in football, it's mainly going to be lower limb type injuries. So you must have heard of people having hamstring strains and calf strains and ankle sprains. So knee injuries are a lot more common as well. Whereas working in cricket, you can certainly get similar types of injuries, especially with fast bowlers, with a lot of the workload that they're having to do. but you're also going to get your fair portion of upper limb type injuries, so your hands, wrists, and shoulder type injuries. In both sports, you can get back injuries that are different from what you tend to get in the general population because of the extra work that they're doing and the extra pressures they're putting on their backs. But I'd say you get that more in cricket than in football. So there is a lot of kind of crossover in terms of the types of injuries that you'll get. But then when you work in certain sports after a period, you'll notice that there are things that are more specific for those sports, certainly.
And just before we move on to talking about communications in an elite sport and this graph, I just wanted to ask personally, when I'm watching a game of football, I'm seeing footballers diving all over the place, rolling around on the floor, in agony. How often do you see those players, going down on the floor, being injured, and then finding out after it was actually nothing at all?
I thought you said people are going to be asking difficult questions and not yourself. It can be said to be part of the game at times. We always take a moment just to see and assess what's going on. So we try not to just rush straight on. There are kind of rules that the referee's supposed to call you on rather than us sprinting onto the pitch. When we go there, we do know the players really well, so we know their particular characteristics and their own behaviours. And when anyone of us have pain, there can be differing pain responses. Is probably the best way for me to describe it. But there are lots of footballers who are very tough and just get on with it, and that can be equally can be a problem as well because they can then do more harm to themselves in the long run. So I suppose it's getting to know your players, and then you can kind of act accordingly.
And just tell us a bit about this graph, growth of physicians versus administrators. What exactly are we looking at here?
Yeah, I was asked just to give some slides, and but not kind of to have too much writing around them. So I put this one up because I use it for actually all my presentations. So as you can imagine, a lot of the presentations I do are for medical staff, but also I do some for non-medics. And I put this up because it's actually a US slide, and as you can see, as time goes across from left to right, in green at the bottom, that's the amount of clinicians there are working, but the big red graph that's going up and up and up is the amount of administrators. So with the same kind of clinicians, you're getting more and more staff who are working in and around them. So that always tells me a few things. One is being part of the team is really important because you're going to have to work with more and more staff around you, and so being in that position to kind of work well with other members of the team. But also, if you're one of those other members of the team, there's lots of people who've got extra roles there now, and when you're then in a situation like we are now with COVID-19, where people aren't working or they aren't being asked to work as much as normal, I think it's important that when you're part of that red group, that actually you are valuable to the organisation. So you add value to it. It's not just you're there as a tick box or as a number, because there could be a time where you actually have to show your value to that organisation. So it's just quite a nice reminder. And who knows, in the future that graph might well change. I've always thought it's important to have staff for a reason, whether it's a staff in the medical department or staff in the club in general. So always reminds me of a story when I was at Millwall. I do remember one of your previous guests was Paul Robinson, who's the club captain at Millwall when I was actually working there. I didn't really go through all the clubs I worked at, but I was at Millwall for a few years while I was working at Tottenham at the same time. And we got promoted from League One to the Championship. And at the time, we only had one, or there were more staff that came in, but just in that department in particular, we recruited another couple of extra staff. And that was good because he'd been at the club for a long time, actually still is there, and he needed more support. And the next game, we had therefore 3 kitmen at the beginning of the next season, and we went to an away game. And we had these 3 kitmen who were actually very, very good and kind of made sure all the kit was ready, but they forgot the kit at an away game because they left it to each other. And again, that was a good reminder that it doesn't mean if you've got lots and lots of people, lots and lots of staff, that they'll actually help the staff in making sure that you're efficient.
I think as well that leads us quite nicely onto communications in elite sport. Communication is, it's an important point, especially with the example that you've just given. Just tell us a little bit about communication in an elite environment, such as top tier football.
Yeah, so I've got a quite interest in this area, mainly from my work in general practice, and there's kind of all sorts of communication. So you can have your one-to-one communication that you are doing now, albeit we've got lots of people listening in, but there's then communication in groups, there's talking, there's on the phone, there's by text, by WhatsApp, by email. So there's lots of different types of communication. And when you then move into football, there's communication on the pitch, there's communication off the pitch. You'll often have people who are saying that, oh, that person, he or she said the right thing at the right time, but we don't often get taught about how to do that, or when we use different types of communication. So that's probably where my interest in this area developed. And so when I was at Tottenham, I used to spend quite a lot of time with some of the coaches there, just talking about their communication with players. So my interest is not so much my communication directly with players that I can influence them, but it's more how I can try and help some of the coaches improving their communication with players. So to give you an example, sometimes you can be very direct in your communication with people. Other times you can be a bit more guided. You can put your arm around and just kind of talk through your problems. And actually, other times you can just follow and just let them get on with it if they're doing well. So it's kind of when to do each of those things. And for me, I think that's a skill. So it's a skill that some people do naturally really well. So there'll be some people who are just naturally good communicators, but even they can get better if they kind of have someone who's kind of working with them. But probably more commonly, there are people who sometimes communicate really well, but other times not. And it's really trying to kind of improve that. So that's been something that I've been quite keen to develop during my time in football. And then I put up this photo because this is Sir Alex Ferguson. You can see a young Sir Alex Ferguson who's there. It looks like one of his early training sessions at Manchester United. And in this picture, Sir Alex Ferguson probably would be the most academically qualified person in terms of his coaching badges or his ability, but you can see he's almost there sitting there trying to have to kind of prove himself to the athletes or the footballers around him, and that's something that I learned being in the football environment, that it's really important to be very, very credible in your communication in that elite environment. You have to make sure that you can speak the language of the players and that they can understand you, and if they do understand you, then more likely to trust you. If they trust you, then you're more likely to be able to influence them. So that's kind of always quite a nice reminder to see a picture like that.
And talking of the current situation that we're in, obviously coronavirus and COVID-19 has really taken over a lot of what we the way we live at the moment. What can we learn from a professional sport that relates to the situation that we're in now?
Yeah, so I can kind of go on to talk a bit more about coronavirus and how we managed or how we've dealt it within our club. In terms of learning from professional sport, there's a lot. Obviously, in the picture to my right, as you look at it, Mark Warburton, our current manager, who introduced me to yourselves and obviously invited me to do this Learn Lounge talk. And I learned working with managers and people like himself, like Les Ferdinand, Chris Ramsey, John McDermott, some of the people that I've worked with very closely over the years, that they have to be very accountable for their performance. So you can have a wonderful week and have some really good communication or really good coaching, but ultimately they will be defined by how the team does on the weekend and their performance. So that was kind of a big lesson for me, because you are accountable for what you do. Now, certainly in medicine, it's similar. If you've got unwell patients, then of course you have to get a lot of your diagnoses right and your treatment right. And so there are some crossovers there between what we do in medicine and elite sport. But being accountable and continually accountable, I think, is really important. I also learned leadership from being in sport, and just hand in hand along with leadership is decision making. I think something that I've learnt over the years is top people or people that you work with want to know about your opinion, and also want you to kind of make decisions. Now, of course, you have to, after time, get most of them right, because if you're making lots of decisions and get most of them wrong, then you'll be found out. But making decisions, being confident in that environment, and giving an opinion, I think those are probably some of the biggest things that I've learned from working in this kind of environment. And that's for working with coaches like Mark, but also top players. They do kind of expect an opinion, so you have to be quite confident with that.
And let's talk about the current situation. How have you and the club been dealing with the COVID-19 situation?
Yeah, so it's been a difficult time for all of us, and by all of us I mean just all the population. So many of the viewers here would have had difficult times and their own stories, and so then when you start talking about the difficulties of football, it does pale to insignificance compared to kind of what some people are going through in their home lives and their family lives. So I do totally appreciate that. In football, we quite early realised that it was going to have an impact. So that was in March when it was all over the news. I think all of us had seen that it was over the news, and those of us who are medics, we were able to get some of the information or more accurate information earlier on. So it was fairly obvious that it was going to be something that would impact all of our lives. And when it became obvious that that was going to happen, what we did at our club was what we increased the amount of communication about this. So I spoke to my two line managers, which are our manager Mark Warburton and Les Ferdinand, and said that this is something that I feel that we need to communicate well to our players, because at that time it was just being discussed everywhere, but most of the information that we're getting were from TV or the internet or social media. I'm not quite sure how accurate that was. So we did a series of presentations, and when finally lockdown actually started, we just wanted to make sure that our players were really up to scratch with the significance of the illness. So I suppose that was the first biggest thing, really, communication. And then the next thing after that was everyone was just sent safe. Firstly, they left our club in a safe way, went to their families, and they were given information about what to do, and that information had to follow the national guidelines about social distancing and self-isolation. In the interim, while players were at their home and we knew they were all safe, myself and the manager were speaking daily, sometimes 2-3 times daily. We're still speaking about that all the time. I'll call him after this, not just to ask how this goes, but also just to plan some things for the remainder of the week. But we were speaking at quite a number of times, and what we were doing was we were just making plans for our club, and we felt that if myself and the manager were on the same page, we could then translate that to everyone else who was important. And the next layer of important people around us were our director of football, the board, our CEO, other staff who were working, those staff who were not working, of course the player. We had to get right. We
Oh, it seems as though Dr. Ahmed has dropped out on us there again. We're going to see if we can get him back on, whether or not it's just audio or whether he has his camera on as well. If it's easier, we'll ask him if... Hi, Doctor, can you hear me okay?
I believe I'm on again. I can hear you. Can you hear me?
Yeah, brilliant. We just missed the last 30 seconds of that response. So you were just saying about how you were disseminating information out to your director of football, and then I think we lost you after that.
Okay, fine. Okay, no problem. I won't start back from my school days then. Don't worry. Disseminating information, I think, was the key thing, and then the next thing after that was to make sure that our players stayed healthy. So they stayed healthy away from the illness, but also physically healthy. they're used to doing so much. So we had 3 different types of groups of players: those who were ill or had contact with the illness, those who were fully fit, and those who were injured. And so working alongside our physiotherapy and sports science team, we made sure they had remote programs that they were doing. And of course, we used all the kind of the media tools that you could in terms of social media, webinar, video calls, those kind of things. We tried to make sure there were group chats, Zoom chats. We had Pilates sessions on board. We tried to make sure there was some sort of competition. We tried to make sure that they were maintaining their fitness as much as possible, because the tricky thing was we weren't sure when they were actually going to come back, and so that was something we had to make sure that we prepared them that way.
I was going to say, it seems like quite a few clubs have taken this on as well. I know my brother has only just gone back to contact training, but this entire time, for the last few months, they've been having mandatory video calls with their dietitians to make sure that they're eating the right things, and it's really not been a holiday at all. I'm guessing you wouldn't have let it be the same for the players that you look after. You've really got to make sure that they're looking after themselves, even though they are at home, still fully exercising, because gameplay resumes in only a couple of weeks' time.
Yeah, that's right. So we had a series of meetings with the championship doctors. The managers were having meetings, the CEOs were having meetings, and we wanted to really get a date for when we could actually resume some sort of contact training. So initially it was just individual training, then small group training, then contact, and then of course finally matches. But physical fitness or running is very, very different from the fitness required to actually play football. So as you quite rightly highlighted, we've only got just over 2 weeks for the first proposed date for the match, and that's really not enough for what we need to try to get our players prepared for. So there's still discussions about that, but we're trying our best to make sure they're as prepared as possible, because what we don't want to do is just get them back into playing competitive elite football and then they pick up lots of issues or injuries.
Let's just talk through these essential qualities that people would need to get into. Well, it says any industry there, but those skills are transferable, I'm assuming, for jobs like yours, especially in sport.
Yes, so I was asked just to kind of talk about what qualities that I feel are really important for sport, but also you can use that for medicine, for kind of all other specialties or careers. I think the first thing is you have to be caring, and by that I don't mean in a doctor-patient type sense, but you've got to care for your organisation, your staff, your colleagues, yourself. So I think if you care for something, then you're more likely to invest in it and more likely to want to make it be successful. So care is something that I think all of us should look for, or to try to do for ourselves and also for colleagues that we want to work with. I put being likable there as well, because we're at work for a long period of time. I think that's probably been highlighted a bit more by this lockdown. We spent so much time at home, and we realised that actually we usually spend a lot of time at work, and people do want to work with people that are nice. So being likable, I think, is really important. Now, when I say likable, it doesn't mean you have to be soft, because if you have to get things done, sometimes you have to be quite direct. But you still generally have to be likable. Whenever anyone talks about qualities, people often talk about work ethic, and I suppose working with some of the people that I've mentioned, that's something that I do notice, that they have got a high work ethic, but they are actually relentless with it. They're almost obsessed with their sport, whether it's football, whether it's medicine, whatever else. They really feel that it's something that's really important to them, and they want to make a difference. And if you want to make a difference and you enjoy it, then it doesn't really feel like hard work. Of course, as life goes on, you want to make sure that you have the right work-life balance, but actually enjoying your work makes it easier to work harder. Being professional, I think, as when you actually start working, you have to do what it says on the tin. So I said right at the beginning, and when you asked me, I talked about communication in an elite environment. If that's all I did, and I wasn't able to examine a joint or listen to a heart or listen to a chest, then it wouldn't work. So you have to actually be professional, make sure that you're a doctor first, and then after that you can kind of build up and start influencing in other areas if your colleagues in your club and your line manager and people around you allow you to do that. I've kept trust in there because I think I mentioned that before when I talked about communication. Trust comes with good communication. So if people feel that they can trust you, or you can trust them, and they're more likely to communicate well. You're more likely to understand them, and then you can hopefully influence them in terms of changing their behaviour in a positive way. And for what I've seen in certainly in football, trust is not just trusting someone on the pitch, but it's also trusting them off the pitch. And actually, if someone's behaviours off the pitch are trustworthy, I felt that when a manager or a coach has to make a decision about trusting them on the pitch, they're likely to go with that. So I think that's just a natural response. If you trust someone, you're more likely to actually just go with them and just depend on them. And then you see the last two, quality and decision making, and probably when you're thinking about careers and thinking about improving yourself, everyone tends to focus on those aspects, the quality. How can I get better? Maybe I should read more. Maybe I should go on more courses. Maybe I should learn to do some other skills. But for me, they are really important. They are essential, but lower down compared to some of the other ones, because quality you can develop when you're working with other people, and if you've got good mentors, they can help you through that. But if you haven't got any of the 4 or 5 areas that I've mentioned before, then you're more likely to struggle. And then similar with decision making, when I said that it's important to kind of get decisions and do them right. Remember, I'm 15 years into kind of working in this environment. I think when you're young and you first start out, you don't have to be that at all. And when I got the job at Millwall in 2007, I was only just a year or so past becoming a sports medicine doctor, and I was working at League One with men like Paul Robinson and with our manager Kenny Jackett. And looking back at it, I didn't know much at all. I didn't know much sports medicine compared to what I do now. But I probably was quite caring and likable, and I worked hard, and I tried to be professional, and it kind of got me by. And even now, when I bump into some of the ex-players who are now managers, it shows how long I've been doing this. When I bump into Neil Harris, he still kind of tells me stories about the days when we were together at Millwall, and that's quite nice to have. So yeah, you can still get by, but you can get by if you've got the first few criteria, and then if you then work on the next 2, then hopefully you can have a good and long career.
Brilliant. Dr. Ahmed, thank you so much for that. It's been so great chatting to you, and I know we had a couple of tech issues on the way, so what we're going to do is we're going to try and answer a few more questions than we normally do. And if it's okay with you, what we're going to try and do is get as many of these questions that we don't manage to answer. We'll try and get them over to you if that would be at all possible, to see if maybe you could answer a couple of them, and then we can put them on the replay page for this Learn Lounge session. So if your question doesn't get answered today, we'll get as many over to Dr. Ahmed as we possibly can. So don't forget to check back on the replay page for this session over the coming days to see if your question was answered. Okay, question 1 comes from guest 656. What do you think is the best pathway into sports medicine from school? I'm guessing that's secondary age.
Yeah, it's quite a long path from school. I would say at that stage, when you're young, I think it's important to show interest if you are interested. So try to kind of shadow someone, go to places where you're seeing people working in that environment, and you can then see if it's actually something that you really want to do. Because to get to this stage, I've kind of tried to summarize it's 15 years since I'm actually working in a club, but another 10 years for when I worked as a doctor. So it's quite a long time in terms of getting to that end goal. But if you show interest and you shadow, you kind of be there and be helpful, then hopefully you can then get a chance. Now, I'm a sports medicine doctor, but one thing that is happening in sports medicine, there are lots of other specialties. So I mentioned physiotherapy. There's sports therapists. Sports science is a massively growing industry where they're looking to kind of understand the game a lot more. There's strength and conditioning when you're looking to develop physical preparation for players. Even within those, there's kind of areas that you can kind of develop in terms of psychology, nutrition, data analysis. Even non-medical, you can think of some of the video analysis that takes place in the games. That's not even touching on things such as coaching. So A lot of these things have some things in, or some areas in common. If you're interested in people, interested in communication, interested in teaching, then you can kind of get in. But if you're very, very interested in sport, then maybe trying to kind of shadow someone and get through that way, I think that would probably be a good start. And then you'll then build up your CV, and then hopefully get a chance.
Guest 908 has asked, do you feel the teams and players are prepared to go back into playing after such a long break where they haven't played?
So with that, we're not surprised, because we've asked them, so we can't fault them for that. But being fit, running in a straight line, or running in kind of curved lines, is very different from being fit to play football. We strongly feel, and I strongly feel, that you need 3 weeks to build up from contact football to being fit to play a professional football match, if you're going to reduce the chance of picking up an injury.
Oh, is Dr. Ahmed still there? Just finding out to see if he is still there. Oh, it seems like he's dropped out on us again. Trust technology, always happens. I think he'll come back in and join us in just a second, and we'll get a few more of those questions answered. Keep sending them through, and we'll get as many as we can over to Dr. Ahmed as we possibly can. Guest 623 asked, is the medical side of the sporting injury hard to get into and to get involved in? But we'll ask him that question next. Dr. Ahmed, you're back. We heard most of your answer there, so if you wanted to carry on and finish that, that'd be great. Well, it seems you might have dropped off again. That's all right. Okay. What we'll say to everyone in the meantime, thank you so much for sending your questions in. What we'll do is we'll get these over to Dr. Ahmed, and he's very kindly said that he'll answer as many of them as he possibly can. In the meantime, though, just to let you know that we're raising money for the Children's Trust. The donation link is on your screen now, thechildrenstrust.org. .uk. It's been an absolute honour having Dr. Ahmed here this afternoon. Unfortunately, we're not going to be able to say goodbye to him. We'll have a chat with him later. But thank you all so much for joining us here this afternoon. Just like I mentioned, we're raising awareness for the Children's Trust. They help to rehabilitate children who have suffered brain injuries and try to ensure that those children who have the best life possible, and every penny helps. And you can donate via the link that is on screen now. Don't forget to tune in to tomorrow's session, and we'll be joined by the CEO of 7 Billion Ideas, David Harkin, as he's going to tell us how he went from washing dishes to becoming an entrepreneur. You don't want to miss that one. Dr. Ahmed, it seems like we might have you back. Are you with us? No, maybe not. That's all right. Take care, everyone. Enjoy the rest of your day. Bye-bye.